Good morning, everyone. Spectrum and my dear friends. Today I'm going to talk about the OCD guidelines 404, which is nothing but dermal irritation of corrosion. So first, it is mainly it is adopted in 24 April 2002. Since it is a revised edition in 24 April 2002. So it basically we are going to see what the OCD guidelines going to say. The main it provides the limitation during the experimentation of the animal for the testing of the chemical for the acute dermal irritation of corrosion. So it's going to prevent the unnecessary use of the animal by the using existing information for the test substance. So it basically prevent the animal usage during the experimentation. So we can limited the unnecessary sacrifice of the animal. First, this guideline, the history of those guidelines that 81, then the revised edition of the came in 1992, which the description of this to conduct how the procedure and how the care should be taken during the test of acute dermal corrosion or irritation. The application of this OCD guidelines would not go this testing of the it provide the how testing strategy like how we have to in which stage what have to be done and validate and accept the in vitro test and different parameters by the in vitro or ex vivo analysis. So in this uh, guidelines, it gives we can use three test the patches to the animal at the initial in vivo test. So first of all, we have to come to know what is the dermatization is nothing but as the production of irreversible damage to the skin, followed by the test for 4 hours. Then it is mainly described by different irritation like erythema mainly occur animal try to like itching will be too much itching will be there on the site of application. Then the corrosion is nothing but production of irreversible damage of the skin and necrosis of epidermis or dermis of the tissue, followed by the following the test substance to be applied for 4 hours and check the ulceration and bleeding, blood T scraps observation for 14 days and discoloration. So basically, we are going to test corrosion and irritation. Irritation it comes with a reversible damage. That what the damage animal got, it can be reversed. It does not show any mark after that application. If the dermal corrosion, it is irreversible. So basically, it's going to show marks like ulceration, bleeding on the site of application um, after the test drug. The different grades are going to be seen. Then it may show alopecia, stats, histopathology of the lesions. So basically, it's going to show the different type of reaction. The corrosion period will be for 14 days. So that up to 14 days, we have to keep the animal for the observation continuously uh, for a particular interval. During a particular interval of time, you have to observe it. In the guidelines, it's mainly to improve the relation between animal welfare concern to evaluate the existing information of the test. So we have to find out the information about the drug, how it's going to act, what is the mechanism, all those things we have to know, and prevent the unnecessary uses of the animal. So basically, this guidelines introduce like how we have to do the active dermal irritation or corrosion by the introduction of definition. Then we are going to see the principal part. Principal part is not chemical is being used to apply it over a single dose of the skin of the animal of the area and test animal are compared with the control so that we can identify how much uh, it's showing the reaction, like how much severity it shows how much effective our drug is for the dermal irritation or corrosion. So basically, it is for the acute offices. So it's the period of 14 days. Then the degree of corrosion and scores have been marked down and completely evaluate the different parameters like histopathology, bleeding is there, or how much like you have to continuously monitor how much severity is going to be taken continuously. Duration of studies is sufficient to evaluate the reversible or irreversible effect. Like 14 days are enough to know the how much corrosion or irritation will be there during our experiment. First, we have to find out the we have to get approval from the CPC, CA committee and Institutional Animal Ethical Committee. So we are going to have like we have to take 1.2 to 3 kg of young healthy albino rats which is above 12 months, so we can use that animal. And we have to like before experiment we have to capture the test. We have to remove the animal fur from his body at 6 centimeter per square. The specific area is mentioned approximately. So we have to remove the intact. We have to find a position where the intact skin to the body is there. So mainly dorsal region is there where we or the animal have to be the intact the fur has been removed from that part. Then the animal should be healthy intact should be like intact position should be removed from the intact position. The hair should be removed. Then the different some type of strain of the rabbit have like some type of strain the rabbit have uh, will grow more faster. The hair growth will be there on the surface of specific part. So we have to avoid that place and we have to find out the place where the thickness of hair, the growth rate of the hair is low. Now we'll go how the CPSC committee have given institutional and provided the specification along by the CPSC even. Now the housing hold feeding condition like the animal should be kept in an individual room, like specific room should be there for each animal, and proper food, feeding and water supply should be there so that animal won't feel thirsty or hungry. And with that, mainly I have said that 12-year old rabbit have been taken albino rabbits. Um, then weight nearby 1.5 to 3. Then the temperature should be nearby 22 plus some minus 3 degrees Celsius for the rabbit so that if more heat is there, rabbit won't feel comfortable, and if cold is there, so that it will not be a suitable condition for the rabbit. And relative humidity should be near between 50 to 60%. If it's if it's less than 30%, it is not suitable for the rabbit. If it's more than the 70%, it is even that is not suitable for them. Especially terms and conditions are there uh, for the animal animal house. Then with the supply of colors, light, artificial lighting or colors, artificial dark. So this have to be considered that not no noise should be there around animal house. So the a rabbit is very sensitive animal, so it may um, affect the experimentation. Before experimentation, the care should be taken and all the parameters specificity. So after removing Skin is covered with a gauze in a gauze with a gauze patch with a held with a non-irritating non-irritating tape, so that it will feel comfortable for the animal. In case where we cannot apply test or chemical substance directly to the animal, the test chemical first applied to the gauze, where the gauze is then applied to the skin, so that the so that our drug can easily have contact with the surface of the skin of the rabbit. The patch should be loosely held in a contact with the skin, mean, mean of a suitable semi-occlusal dressing, like how we used to do dressing of a tissue if any damage is there. So for the duration of exposure period is also mentioned in supplements. Then the test chemical is applied to the patch uh, after producing irritation. Uh, After producing irritation corrosion to the skin, then the test chemical have been applied to the over the skin. It should be attached to the skin in such a manner it should have contact, good contact and uniform distribution of the test chemical on the skin, which is then compared with the control. Control the severity is graded and it is observed. So we have to be careful that the patch ingestion or inhalation of the test chemical should be prevented. Uh, if the animals start leaking, so it won't be like the effective concentration of drug won't be, or it may harm the because it may harm the animal due to its quantity. If it's liquid, it will be undiluted. So it is potent form, so that it may harm to the animal and may cause the organ toxicity or any other systematic toxicity. So we have to be careful that animals should not ingestion. Same way like inhalation, if the animal is going to continuously inhale the smell of the drug, it may affect the animal respiratory system and it may cause the toxicity. If it's liquid, it will be in undiluted form, so that it is in a potent form. If it is a solid, first we have to make a solid, we have to pulverize or size reduction has been done. Then the specific we have to moisturize with a water a vehicle. A vehicle should be chosen in such a way that it should not produce any irritating effect to the surface of the animal. So we have to find out in such a way the vehicle, like mostly water should be used, and it is in a form of paste. Should be applied. It has been applied to the gauze. So by gauze, it is applied to the animal. So if the if water cannot be used, so we have to for another choice we have to go for any other substance which should not any other vehicle which should not cause any irritation to the skin of the animal. By like if we cause the animal irritation due to the vehicle only, the experiment won't show enough effective parameters. Then we'll go for the how much at the end of the exposure of period with the normally 4 hours, like after 4 hours exposure of test to the skin, the test is removed, and using water or any appropriate without alternative existing response integrity of the epidermis. Doses mainly it is 0.5 ml. For the solid it is zero point 0.5 gram. So it will mix with the solvent. So we will go for the initial test. When a test chemical has been judged to the corrosion irritant or non-class based on the evidence, like we have to find, we don't know what type of effect it's going to show, corrosion or irritant or unclass, like other than that corrosion or irritation of the skin. So by previous analysis of in vitro test, ex vivo test, preliminary analysis of the drug like SAR, then phytopharmacognosy if a drug from the herbal food extract. So we have to find out what are the components expressing, what are the uses of that component. So we have to find out all those parameters. If it's necessary to do in vivo test, then after um, without if the test does not show uh, any significant effect, does not show any much effect during the in vitro like ex vivo or satisfaction, so we will go for the in vitro test. In in vivo test, I'm sorry, in vivo test will go. Then the animal have to approaches like three different test patches are going to apply to the subsequent to the animal. First patch is removed after 3 minutes. So we have to find out any severe reaction is there or any serious skin allergy or serious skin reaction. And then we have to find out how much effective, like if it shows the irritation, you have to terminate. If so much irritation to the animal, the experimentation part has to be terminated. And second patch, it is applied different at a different remove of one after one after 1 hour. Like the patches have the second patch has to be applied, and then after 1 hour it has been removed. And we have to find out how much reaction it's going to compare with the control animals, like control test and standard. So we have to grade it. After that we have to do the third patch we have to apply, which is extended for the 4 hours. After 4 hours we have to remove the patch and we have to grade the response, and we have to find how much it's going to show allergy. So any point of time when it shows the allergic reaction or any too much irritation or toxicity to the site of so we have to terminate the uh, experimentation part. So it should not cause much any harm to the animals other than the irritation or corrosion effect to the animals. Then after initial test we have to go for confirmation test by mm, if the no corrosion effect after initial test, like after 4 hours, after 3 minutes, after 1 hour, it does not show any much effect, then we have to go for the confirmation test that our drug is safe for the acute dermal irritation or corrosion. So it is a short period of studies. The corrosion effect is not observed. The initial test shown the negative response that it does not produce any much effect for the irritation. So additional two animals will take each with one patch for exposure for 4 hours. Again we will take the two animals will apply one patch for 4 hours continuously. So it will show how much significant effect it will. First we have to remove the franking. We have to find out the intact part of the animal, and we have to apply the drug to the gauze. Then we have to apply to the animal, so that in a such a way we have to do dressing, so it should not produce any irritation. It's not produce any unpleasantness to the animal. Then for the confirmation test, the irritation effect should be observed in the initial test. Like if it shows the negative, then we have to go for confirmation test. If uh, if any irritation effect is observed in the initial test, the confirmation may be conducted to subsequent manner. So it may show any response to any corrosion effect or irritation effect by the drug, or it does not show much effect. So we have to go for the confirmation that we have to confirm whether our drug is effective or not. The exposure of two additional animals simultaneously. We have to take two animals and we have to test for it simultaneously. The exceptional cases if the initial test is not conducted, two or three animal we can use instead if we didn't do the initial test. So animal may be treated with a single patch which removed after 4 hours. Like single patch you have to apply over the skin and it is removed after 4 hours. And when the two animals are used, if the both exhibit the same response, no further testing will be there. If the animal shows both the animals are showing same test, it should not be tested for another third animal. See, if the animal shows same response, so no need to do further tests for the another one animal. So we can stop the test and we can find out, come to the conclusion and report by this. If does the two animals show different response, then third test should be performed so that we can confirm mm, our our report that we have find out this, like it may show different reactions, so we have to carry out for our conclusion third animal if it doesn't show similar reaction. Observation periods will sufficient to evaluate the reversible side. We have to find the reversibility for the irritation effect. If that irritation goes after the applying of test chemical substance. So during if the show continuous sign of severe pain or distress, we have to terminate. Like if the animal show different too much pain due to the test substance or due to the test substance after application after during the experiment, we have to terminate the experiment. So the observation period should be same for both irreversible or reversible, 14 days. We have to keep on observation for 14 days for for the experimentation. After removal of patch, so clinical observation we have to observation clinical observation will be there. We have to find examine the signs of arrhythmia or edema, like if any severe irritation or swelling or accumulation of fluid is there on the site of um, where the patch has been applied. So the response of grade we have to, like after the removal of patch over after 60 minutes, then we have to then at 24 hours, then 48 hours or 72 hours after the patch removal, we have to observe, like after 24 hours we have to see after 48 hours and 72 hours, like different intervals of time. We have to see what are the condition of the site where we have applied the drug. So initial test is only initial test in one animal, and a confirmatory test will be done on two animals which shows the same response. So after removal of patch, then only will come to know what are the different, how much effective our drug it is. Dermal reaction is graded accordingly in the table as I shown in next slide. If the damage of the skin due to irritation or corrosion at 72 hours, the observation mean needed for until 14 days. Determination of the reversibility of the test effect. Additional observation, initial irritation or local toxicity effect, such defatting of the skin or systematic adverse effect. So we have to be careful. We have to continuously observe the body weight. What is going to be show any and whether it's going to show any systematic adverse effect or toxicity or any other problem. So grading has to be done for the skin reaction, like for arrhythmia. If different grade is there, up to 4 is the maximum grade, which shows the highest severity of the animal. That animal is that it shows the highest severity. If it's the severity of the um arrhythmia is less, it shows the 0. So if no arrhythmia, it shows 0. If very slight arrhythmia, it shows 1. well-defined arrhythmia is there, then 2. In moderate or severe arrhythmia, it shows 3. If the severe arrhythmia is there and brief redness is there, of the escalation of formation prevented grading of the arrhythmia. These gradings will compare with the control uh, test and standard. Then edema formation, edema that if no edema is there, then it will show 0. Maximum grading is 4. Like it will show how much edema is present. If very slight, it will show 1. If a slight edema, then it will show 2, which shows the area well defined. Raising, like swelling will be there or inflammation will be there at the site. Accumulation of fluid. Moderate edema will go that fluid accumulation will be approximately 1 millimeter. If severe edema is there, it is more than the 1 millimeter, and beyond it may go beyond the area of the exposure. Like how much drug you have applied, if it's showing more than that arrhythmia. So we have to compare these observation of arrhythmia and edema with the with that of control and test and standard. So standard and test drug can be done. So it is a acute dermal acute dermal irritation or corrosion for 14 days. Next, I'm going to show the grading of skin reactions. Now, the negative control, like if it does not show much skin reaction or arrhythmia, it will show negative. No symptoms will be there. Clean, clean as like it will not show any theme like that of normal rabbit, which does not show any arrhythmia effect. Grade 1, it shows some arrhythmia redness. Grade 2, slight will be arrhythmia will increase, and severe arrhythmia in grade 3 and grade 4 like this. Next, we can compare these, how much area it is covered, like corrosion also we can see respiration, and how much it causes damage to the tissue or organ. So like this we have to do the mm, this like this we have to do the test for the acute dermal toxicity corrosion. Now in brief I am going to revise all those. Like first introduction, we have to see the reversible or irreversible damage over the skin of the animal. Irreversible mainly represent the irritation effect, and irreversible damage still shows the corrosion effect. So by this, the 40 duration of test will be the 14 days, and different sign reactions we have to observe for arrhythmia or edema on the skin, or ulceration or bleeding of the scare during the corrosion. So we have to reduce the usage of animals. So we have to keep on observation, like how much we can do a test, and we can prevent the usage of much animals. Then principal part, we are going to have seen that how it's going to, how much duration of interval, how much the basically what the source OCD guidelines 404 provide, like how we have to do the test, carry out the test for us. Then we just before 20 hours we have to remove the fur, we have to apply, we have to cover with a gauze so that it should not expose to the air, so the it does not produce any harmful effect to the skin with the environment. So you have to see that. Then other like 1.5 to 3 kg of 12 months albino rats can be used, as I said. And franking, from where we have to find the place from where we have to remove the intact fur from the, we have to find the intact place of the where the skin is attached to the surface of the animal intactly, and we have to remove the fur where the that much hair won't grow due to aging of the animal. Then housing hold condition, as the CPC approval says, it should provide a sufficient 12 hours day, light 12 hours dark. Then temperature like 20 plus or minus 3 degrees Celsius, and humidity should be 50 to 60 percentage, and proper feeding and drinking to the animal should be there. Next, it's like what we have, the tape should be non-irritating, so it should not produce the damage or severe effect to the irritating due to non-irritating tape. So we have to be careful that what we are using, it should not produce any uh, it should not interfere our experimental semi-occlusal dressing. Then contact we have to place the drug in such a way that it should produce a good contact and distribution of the test chemical. All those we have seen the maximum time it's 4 hours. Observation period is 14 days after removal of patch. So after 24 hours, after 72 hours, after 48 hours, and after different interval times, we have to see. First batch will be applied after removed after 3 hours. We have to see if no such reactions are there. Then second test can be performed. If no second test, second patch has been removed after 2 hours. If no severe reaction, we can go for third patch. So it will show. It will be keep on for 4 hours. After 4 hours, we have to remove the patch, and we have to keep for the observation for the animal for 14 days for in corrosion and irritation. Like we have to see and we have to grade how much basically on the clinical evaluation parameters. So it's like different grading will be there 0 to 4, maximum is 4. So how much erythema or edema is present,